Nicole Massie. I'm a urologist / urogynecologist at Urology Centers of Alabama. Started my education as a urologist. I went to the University of Virginia undergrad and went to medical school at UVA and came to Alabama for my residency. I met my husband there. I became an MD in urology and then started my family. So I have three children. Started in my residency with my first child, and then it was boom, boom, boom. And then I decided, when they were fairly young, to go back and get my recertification and training as a urogynecologist. I've been in urology for many years, and although I still practice urology and I still see men, I've really focused most of my interest in taking care of women, and I've been doing that for the last 15 years. Urology Centers now has a women's center that's dedicated to treating women, and I've been there for several years now, practicing with 3 of my other colleagues, and we're dedicated to helping women with pelvic floor disorders. I really enjoy working at urology centers. I mean, I love our work community. I've gotten to be friends with several of the physicians. A lot of us had children at the same time, so our children have grown up together. I think it's really nice to have doctors that support you, that help you out, that you can go to when you're not sure about things, and it just makes for a really nice work environment. So I have 3 children, and my husband and I are both physicians. So I'm sure it was kind of tough for those kids to grow up in that sort of household, but you know, they've really thrived and done well. My oldest is in a biotech type company, works for a biotech company. He really enjoys both the business aspect and the medical aspect. My middle son is going to medical school, so that's very exciting for him. And my youngest, who's a girl, my daughter, plays soccer at Furman. She loves soccer, but is also interested in possibly going into the healthcare field. At no time did my husband and I ever say, you know, medicine. We never pushed them towards it or away from it. I think they just kind of gravitated that way. I'm a golden retriever mom. I've had golden retrievers ever since I can remember. We have a dog named Bess and a cat named Thibodeau, and they get along very well together. We've always had a golden retriever, and we've always had a black cat. So that's what we got right now. Well, outside of work, I mean, now that my kids have moved away, we've had to come up with some different hobbies, but my husband and I really enjoy hiking and being outside. We like to ski, but just being outside, I mean, enjoy going for walks, and I'd love to travel. I want my kids to come everywhere with me, but now that they're grown up, they don't really want to go so much, but being outdoors is really fun. I think what I find the most rewarding working with my patients is it's not sometimes just fixing their problem or anything. It's just the conversations, and we've seen each other over time, and I've learned about their families, they've learned about mine, and we've just kind of been through a lot together. I like to see people back that, you know, we've seen over several years, and they'll come back, and they may have had grandkids now, or they've gotten married, and it's just, I find that rewarding. You have that close personal relationship, and there's a lot of jobs that you don't really have that in. You know, you see them once and you'll never see somebody again, but we tend to see people back again, and it's nice. You know, when we done surgeries for women or helped with their problems, they come back and they're so happy and appreciative, and you know, it makes you feel good, and also because you've changed their lives a lot. They'll say, you know, this has made such a big difference in my life, and that makes anybody feel good. But you know, you put a lot of care into taking care of this patient, and it's nice to hear something like that.